Celine has been a midwife for more than 30 years in Quebec, actively engaged for the legalization of the midwifery practice. She is a past president of the Quebec's Midwives Association and currently a member of the board of l'Ordre des Sages-Femmes du Québec. She has her baccalaureate in nursing, master's in anthropology, and a PhD in applied human sciences from the University of Montreal. And she's teaching as a senior lecturer in midwifery for the past 10 years at Université du Québec à Trois-Rivières in Quebec. And she has 3 children and 4 grandchildren. Thank you so much for being with us today, Celine. And I'm going to turn off my video, but please, if anyone needs help, just message me in the chat.
Oui. OK, oups. Oui, bonjour tout le monde. Hello, everybody. Yeah, the title is how to put together wisdom with professionalism and quality of care in midwives. C'est vraiment être capable de lier. Je veux parler de la sagesse pratique. So today, je vais faire le contexte et quel est le problème, quelles sont les questions et vraiment comment j'ai fait pour une revue de littérature, quels sont les résultats et ensuite les réflexions en lien avec la pratique sage-femme. So it's a plan of what I will explore with you. Oh, okay. Let me check. Is it okay? Is the context? On parle de la rationalité instrumentale ou technique, which is the context of our culture in Western, but in a lot of place in the world. So c'est la centration sur les procédures, les protocoles, comment on peut résoudre des problèmes de façon instrumentale, c'est-à-dire il y a un problème et on a les solutions, il y a des recommandations et c'est très simple, peu importe la situation. Donc, et utiliser le savoir scientifique qui est prédominant. It's almost exclusive for scientific knowledge. And evidence-based medicine is the best example of rationality, instrumental rationality. And it's poor to be able to deal with complexity and individual care. So, donc, c'est pas vraiment adéquat pour quand on est dans la complexité et aussi le soin individuel. Qu'est-ce qui se passe avec les sages-femmes? Elles vivent en clinique 2 injonctions en même temps. D'abord, suivre les protocoles, les lignes directrices, aller vers une pratique standardisée, tout le monde a la même chose, et en même temps, donner des soins individualisés centrés sur la femme. So it's 2 things that we expect midwives to do, follow protocols, algorithms, guidelines and best practice thing and leading to a standardized practice. And at the same time, expecting midwives to do woman-centered care and individualized care. So it brings some ethical tension and very sometimes conflicting for midwives. What is the best thing to do? Okay. What is the best decision to take for this person at this moment in this situation and this context? It is not simple. So why I was interested by that? Because in Quebec, dans la sagesse et la profession de sage-femme au Québec. There was three polls or 3 occasions where we are talking about wisdom. La sagesse a été mentionnée au Québec dans un travail d'une thèse de doctorat comme moyen de faire évoluer la profession, dans une recherche sur l'identité professionnelle comme étant la valeur contenant des valeurs partagées chez les sages-femmes et dans notre ordre professionnel qui a lié, c'est le seul à tout le Québec, qui a lié la sagesse au professionnalisme. So there was three important things that came in where I practice. So in a PhD thesis and in a research on professional identity as a continent, values for all the other values shared by the profession and for our College of Midwives who revised their standards and name officially, publicly, linking the wisdom to professionalism, which is so that was important. And I'm talking not about the philosophical wisdom, but it's a practical wisdom, which is Aristote, ce qu'il appelait la phronesis. C'est pas la sagesse philosophique, c'est vraiment pratique. So, let me see. Donc, la question principale, c'est comment comprendre la place et le sens de la sagesse pratique en santé, dans les soins de santé. Est-ce qu'on peut l'apprendre? Est-ce qu'on peut l'enseigner? Est-ce qu'elle peut se développer? Est-ce qu'on peut la cultiver? Et ensuite, quel lien on peut faire avec la pratique sage-femme? So, can we learn? What is the place in understanding of practical midwives in healthcare? Can we learn it? Can we teach it? Can it be developed and can it be cultivated? So what can we think for midwives after that? So what did I do? And I had j'ai eu des mots-clés. Practical wisdom, phronesis, nursing, midwife, sage-femme, infirmière, medical, medicine from 2000 to 2002. And there was 36 articles on 564. And I add 3 books that I had because I'm teaching midwifery. And there was on the 36, sur les 36 textes retenus, il y en a 30 qui étaient liés à la discipline médicale. Il y en avait 4 qui venaient du nursing et il y en avait 2 qui venaient de la pratique sage-femme. So I was surprised by that most of the text and research and commentaries and discussion about practical wisdom were came from medical discipline. So, wow. Okay. So qu'est-ce que la sagesse pratique? What is practical wisdom? Donc, c'est important de comprendre que c'est un processus et non pas une procédure pour prendre une décision. You cannot have an algorithm for practical wisdom making a decision. It's a process. Ça demande de la considération, du discernement et de la délibération pour prendre la meilleure décision pour le bien de la personne dans un contexte. Donc, they say most of texts, they say we need discernment and deliberation in order to make the best decision for the good of the person in a context. I was surprised by that because I'm a healthcare professional. So I thought it was in order to have the result is healthy or health. No, it's for the good of the person. So, and it's a way, c'est une façon de prendre en compte le général, donc les règles, la science, ces choses-là, et le particulier en même temps. Euh, OK. Il s'agit d'une compréhension profonde d'une situation, en plus d'une disposition à agir dans l'incertitude et à apprendre de l'expérience. Ça devient une forme de savoir en action. It comes with a deeper comprehension of a situation and being willing to act with uncertainty and to learn from experience. So the practical wisdom create a kind of a experiential knowledge. Donc, il s'agit de faire un jugement situé et un choix pour cette situation-là. We have to understand the situation and deliberate what is the best and all that, discuss and think and all that, and make a judgment and a choice and to act. C'est un concept qui est complexe et abondamment discuté dans la littérature médicale. It's not a simple concept. There's a lot of discussion. Some authors talking about the slippery concept. So, and I find it's good because, it's like the mystery of something that appears to be good, but it's not tangible. So, alors, voilà, c'est bien comme ça. Qu'est-ce qu'on peut faire? Il s'agit de reconnaître comment on reconnaît la sage-femme pratique, la sagesse pratique. Mais tous les auteurs parlent que c'est une vertu, donc des attitudes et des aptitudes. Ce qu'on peut voir, c'est l'intelligence émotionnelle, la capacité de réfléchir, la capacité de voir le gris et de savoir comment improviser et utiliser l'intuition et comment on peut interpréter les principes et les règles en contexte. So we see that emotional intelligence and being able to reflect and being able to see gray, which is what we are used to in midwifery practice, and knowing how to improvise and utilize intuition and how it's somebody who can interpret principles and rules in context. Et de la réceptivité, l'adaptation à une situation. C'est une façon d'agir comme professionnel en voyant la pratique comme un art. Et c'est vraiment une volonté de communiquer avec les autres. Donc, c'est quelque chose, une réflexion, une délibération qui n'est pas toute seule, mais qui peut se faire à la fois chez un individu et aussi en groupe, dans un groupe de pratique, dans une équipe de travail. Donc, is about receptivity and adaptation to a situation. We have to adapt and not, standardize, practice, and just routine. You do the same thing, whoever is there, you apply recommendation. And if you think that the best practice, professional practice is only applying rules and guidelines and protocols, it's without any consideration for the individuality of the person. At that time, you consider the person as an object of care and not a subject of care. You impose or you apply some rules on there. Deux minutes. OK. Quelle est sa place dans les pratiques en santé? Donc, dans tous les textes que j'ai lus, c'est très, très clair. Il n'y a pas il y a pas de doute. Il y a un lien qui est très clair avec le professionnalisme. La sagesse pratique a un rôle clé pour rencontrer les défis de la pratique. C'est considéré comme indispensable pour une pratique de qualité. C'est un sine qua non pour le professionnalisme. C'est central pour rencontrer les défis de la complexité et ça a un rôle crucial pour toutes les phases des soins de santé. Donc, clear link to professionalism, a key role to meet the challenge of practical, and the challenge of complexity is central. It's indispensable for quality of care and professional care too. So it's a crucial. So, uh, and there's no doubt about that. Il y a pas, tous les textes étaient très clairs, c'est important, mais c'est plus qu'important. C'est indispensable pour une pratique de qualité. Comment est-ce qu'on peut l'apprendre? Il faut savoir que c'est pas inné, c'est pas une théorie et c'est pas un résultat. Donc, ça s'apprend avec le temps et l'expérience dans un environnement de travail. Ça s'apprend par la réflexion sur le travail, sur ses actions et sur soi-même, par le dialogue et les histoires partagées. Donc, we can learn practical wisdom, but it's not innate. It's not a theory. It's not a result. You don't become wise. It's not like that. And you learn it with time, experience in working on the field, in the working environment. And you can learn it by reflection on what you do, on your actions, on yourself, with dialogue and sharing stories, which is a royal way to go and find a wisdom in the story. Est-ce qu'on peut l'enseigner? Les, les textes recommandent ou demandent que ça soit inclus dans les programmes de formation. Il s'agit d'aider l'étudiant à prendre des décisions dans des conditions d'incertitude et de développer l'habilité et de développer, oh, mon Dieu, excusez-moi, l'habilité à développer un jugement, à se faire un jugement. Elle ne peut pas s'enseigner comme une procédure, encore moins comme une recette. Donc, c'est la place centrale à la narrativité. So it should be included in all program for formation for midwives, healthcare professional too. And we need to help the students to be able to make a decision in the condition of uncertainty and to develop a way to make it develop his own judgment, professional judgment. It's not about just obey to protocols. Cannot be teach as a procedure, and it's not a recipe. There's nothing. And it was a text, one of the texts in midwifery discipline was the central place of narrativity. Narrative pedagogy, and I see some texts in medical community now. You see the narrative practice of medicine. It's like, wow. And it's about stories, listening to stories and go from the emotion and what we think and so it's interesting to say it's not in the book, it's in stories, lived experience, stories from students, from other midwives, from parents. Et quels sont les meilleurs professeurs pour en parler et l'enseigner? Ce sont des praticiens qui sont matures et expérimentés. C'est pas des théoriciens, c'est pas ceux qui ont beaucoup lu. So best teachers are really mature practitioner and experimented. So they should come and meet the students and talk about how they make their own judgment, how they do that. It's not about having read a lot of books. It's practical. That's the key. It's practical wisdom. It's not something theoretical. Est-ce qu'on peut la développer? Ah oui, on peut prendre l'habitude de rencontres d'équipe l'habitude de créer un temps et un espace sécuritaire pour échanger et apprendre à partir d'une histoire partagée. Il s'agit de faire de la place pour les nuances et la flexibilité. Yes, we can take team meeting. Sometimes we can talk about, interdisciplinarity, but start with just the same team of midwives and create a time and a safe space to share stories and exchange where you don't are not afraid of sharing your emotion, sharing diverse way to interpret a situation. And it's time to make place for nuance and flexibility. Attends une minute. How we can cultivate it? Comment on peut la cultiver, la sagesse pratique? C'est essentiellement par une pratique réflexive. Là aussi, les textes sont clairs là-dessus. Il faut être prêt à apprendre de l'expérience et par la réflexion. Il faut savoir questionner soi-même, ses actions et les systèmes. C'est l'occasion de créer un savoir professionnel qui n'est pas dans les livres, qui n'est pas dans les manuels qu'on apprend à l'école. Et pour la cultiver, ça contribue à l'épanouissement des praticiens. C'était intéressant de lire ça aussi. Et on peut contribuer à créer un milieu ami de la sagesse. Oui, baby-friendly place, mother-baby-friendly place, or it can be wisdom-friendly place. The having the habit to cultivate and to bring a culture of reflexive practice, to be able to learn from experience and to challenge diverse and sometimes contradictory perspective about a situation or a story. It's some books are talking about wisdom as a professional knowledge. So it's amazing because for one session of discussion and reflecting and knowing, learning what was good, less good, knowing about myself, I have bias, I have things, and how can we do better next time? So we create things each time. So it's very precious for professional. It's not about applying theory. Et la pratique réflexive, ça a un potentiel autant d'évoluer, ça permet d'accepter la complexité, ça peut aider à analyser une situation. C'est un processus, mais qui mène vers la transformation et vers l'autonomie aussi. Donc, la pratique réflexive est un moyen de continuer à se développer comme professionnel et non pas juste agir en conformité. Euh, donc, je trouvais que c'était un processus qu'on devrait valoriser. Ah, ça, c'est une citation oups, attends une minute, de la pratique réflexive que je trouve importante. Out beyond ideas of wrongdoing and right doing, there is a field. I will meet you there. C'est ça, une pratique réflexive. C'est pas qui a bien fait, qui a mal fait, c'est pas ça. C'est vraiment créer un espace où on ne cherche pas à évaluer et juger les personnes. Fait que quelque chose qui me paraît important. Et l'autre aussi, je l'avais déjà mis dans un autre chat. A team is not a group of people who work together. A team is a group of people who trust each other. Ça, c'est ça aussi. Dans d'autres présentations aujourd'hui, on a parlé de bullying, on a parlé de oppression, on a parlé de plein de choses qui rendent la pratique sage-femme vraiment difficile. Et donc, l'idée de créer une équipe de travail est vraiment fondamentale pour qu'on puisse avancer à la fois comme personne, mais aussi comme profession. Euh, OK. Qu'est-ce qu'il y a pour... Une minute. Oups. Qu'est-ce qu'il y a pour les sages-femmes? Ben, c'est une force qui peut guider et développer le sens de l'identité professionnelle. La sagesse pratique, ça peut honorer l'éthos professionnel, sa raison d'être, sa culture, et tout en utilisant evidence-based. C'est pas un ou l'autre, c'est un et l'autre. Ça permet une pratique qui n'est pas uniquement standardisée et en conformité. Et c'est une façon d'assumer l'incertitude inhérente de la vie et du travail. Donc, practical wisdom of phronesis can be a guiding force to develop the essence of professional identity of midwives. It can honor the professional ethos of Sashram, or culture, and at the same time, you can utilize evidence-based practice. It's not one or the other. You don't have to choose, and it helps to have a practice that is not only standardized or conform to rules that can is risky to dehumanize the patient and the practitioner too, because we're just an instrument of care. We're not caring. And it's a way to assume the inherent uncertainty on life and of labor, of our, not labor of childbirth, but our work. It's, okay. C'est une façon de valoriser une pratique relationnelle versus une pratique procédurale. C'est une façon de valoriser les processus et non pas seulement les résultats. Ça permet d'utiliser une approche de jugement professionnel par rapport à une approche technique, et ça aide à développer une culture de pratique réflexive. Le fait de partager des histoires devient importante. Ça permet de parler de la pratique comme un art et non pas simplement comme une technique. Et ça l'aide à garder le sens de la pratique professionnelle. So it's a way to value a relational practice and not procedure. Value the processes and not only the results. We need to utilize the judgment, professional judgment, and not just technique. And what is characteristic of any profession is that they use their judgment as professionals. So it's not normal to expect midwives just to be a good technician or just to follow the rules. It's not just that we need to value the judgment. It's a road to cultivate reflexive practice. And to see the midwife practice as an art and not just a technique. Okay. Et de façon essentielle, il s'agit d'utiliser le jugement professionnel pour une pratique de qualité et aussi savoir questionner la nécessité de se conformer. Essentially, as I said, it's like we need to be able and to value and to respect professional judgment for quality of practice. It doesn't mean that when you have judgment, is always a good judgment. We know when we practice that sometimes, oops, that was not the best. Sometimes we miss something. Sometimes it was not a good decision. This is not the point. When you think and you reflect and all that, and you make a judgment, you assume that this is being a professional. And it's about also to know how to question the necessity to conform. I think midwives can do that. And they say in most of the text too that practical wisdom or phronesis has a potential for flourishing. They talk about flourishing, and it's l'épanouissement professionnel. So we need that in our profession because it's not easy, but we feel good. So I think it's important. En conclusion, ça peut être le temps de penser, de valoriser la place de la sagesse pratique dans l'agir professionnel sage-femme. Ce qui sera bon pour notre profession unique et importante pour les femmes et les familles, ça va être bon pour ceux que nous servons. And what else? Yeah. So, ça, c'est les trois livres qui ont servi de référence et j'étais fière de moi, j'avais créé un code QR pour toute la liste des références que j'avais, mais je suis pas sûre que ça fonctionne encore. Je suis désolée. Pardon. Si jamais il y en a qui veulent la liste des références, ça va me faire un plaisir de leur donner. Alors, merci. Bonne journée internationale de la sage-femme. Et s'il y a des questions et des commentaires, ça va me faire plaisir d'échanger avec vous. Merci bien. Je vais arrêter le partage.
Thank you so
Voilà.
much, Celine. That was wonderful. So, does anyone have comments or questions? Please put them into the chat. Just lots of hearts right now.
Merci. Thank you.
No, no
If
questions,
anybody
maybe.
wants to ask a question, they can now do so because I have allowed I have allowed them to unmute themselves.
Thank you, Linda. So go ahead, don't be shy. You can unmute, even just to make a comment, because I think that there was so much wisdom in that talk, and I really enjoyed the way you described that it's an art, even though, and I think we forget how much art there is within the sciences, like we're still bringing a human angle and a perspective to it. So there's a comment here from Kate. I like what you say about uncertainty. We need to encourage our students to understand the impact of fear and anxiety on our decision making, particularly when we do not feel safe within the system. That's a very good
Oh,
quote.
yeah. And we are in a culture of risk all over the place, always talking about that and thinking about risk and making informed choice with women. And finally, it's relating to fear, what something is going to happen. And we have evidence base is pretending that it will bring certainty and results and proof, which is a false expectation, and we are not able to deal with uncertainty of life and imperfection and the fragility of human life with and yeah. And so I know that from cavern age, women are fears of being when they are pregnant, and is it okay? My baby will be okay. Will I survive? I understand. I had 3 children. But if a midwife is practicing out of fear of life and of uncertainty, it raised questions for me. That's why we need wisdom. We need to be able to deal if we want to welcome life, we have to welcome, accept, and respect the uncertainty, the imperfection of human beings, of life, and even in physiology, you know. So, yeah, it will help us to be healthier.
Yes, very, very well said. And I think you're right. The importance of really integrating this into education as well and passing these messages along that we're not just teaching the protocols.
Ouais, ouais.
So Catherine is asking a question about litigation. Many midwives practice in a climate where risk of being sued is high.
Yeah, but yeah, I know. And even in Canada, where I live, in fact, there's less soon in obstetric, but it costs more, but it's less soon. But it's a fear at being blamed. And it's the same for women. We want to help them to make choices, and they fear about the consequences. Uh, we cannot have a defensive practice. It's not a good thing. And legally, we are uh, we are not related to the results. We are related to the decision we make and the action. So it's important to be clear, work with rigor and love, and be able to think, because there's and AI will not think for us. We have to deal, and it's a human thing. Yeah.
Yes. And and I can add about this because I think it's a big conversation is this fear of litigation for both midwives and obstetricians. And there's some new work that's emerging from some human rights attorneys from the Center for Reproductive Rights looking into this and actually hopefully working with maybe even ICM on developing some modules to help educate midwives about laws and fear and this is actually a project that I'm working on, so so
Ah,
this will hopefully be coming out soon,
super, c'est
because
super.
I think because we need to dispel these myths, and I think the only way to do it is
Mhm.
to bring the lawyers in and talk about it because the fear is greater than the real risk. But
Absolument.
we have to
Absolument.
we have to talk about it.
Yeah.
Anyone else would like to unmute or put another question in? Yes,
I I think about this a lot. Is anyone else talking?
go ahead, Catherine.
Hello, everyone. Nice to see you. I see some faces I've known for a long time. I do think about as I'm pursuing my PhD in midwifery in nursing now, and thinking about how midwives and physicians enter the birth space or reproductive health space differently. And I do think that the humility that we bring to the work allows us to be comfortable with the mess. Or
Mm.
or there's some relationship there. There's some relationship that the ability to stay in the unknowing and to be okay with that. That I don't have to know. I'm not threatened by not knowing. But I think maybe in medical culture there's something more to their threat of not knowing has been so hyper stimulated or so beat down in medical school that they just have a different relationship with uncertainty and they're not able to access their humility. So I don't know what that is
Hmm.
exactly, but it certainly resonates with me what you're saying.
Oh, yeah. And it's the illusion and the will to control. Knowing
Oh,
nature,
totally.
control nature, and if we're out of control, we're not comfortable and say, hey, no, no, it's ecology is that. You
Mm,
cannot control everything.
yeah. And I think part of their certainty or even their unknowing, the fact that they don't know what they don't know is what makes them unsafe. And so then
Yeah.
their decisions are fear-based or anger-based or frustration-based or disgust-based or whatever, as opposed to being able to say, what don't I know? What questions do I need to ask? Because that, I think, is the skill. And I don't know if that's the entire art or maybe part of the art, but I think that's related.
Mm. And it's okay not knowing because it's new. You know, childbirth is emergence and it's a new life and it's unique. I had the privilege to be help a woman with the seventh of all this family at home over the years. So every time it's unique, she's different, and it's the baby and the childbirth and all that. So we have to honor unicity of human beings and not, a conveyor belt is not very good for obstetric. It's